Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
Welcome to another episode of the Healthy Chicago podcast. My name is Stephanie Harris, and I am the Victim Services Lead at the Community Safety Coordination Center. My role primarily entails working with community stakeholders throughout the city of Chicago who are working to provide critical supports to survivors of violence citywide. And with me today, I am so excited to introduce my amazing colleague, Saleshea Peterson, with Hug a Child non-for-profit organization. If you can just share a little bit about yourself and the work of your organization.
Hi, I am Saleshea Peterson, the founder and CEO of Hug a Child non-for-profit. It's a social service entity. It started off as an anti-violence and gun awareness mentorship program in the city of Chicago. As I went further into that, I found out that my craft and what was needed in the city was victim services and being dedicated to prevent violence and bring violence intervention. More resources as far as mental health resources, housing, funding, and being there for survivors who have experienced gun violence, meaning mothers, fathers, sisters, brothers, cousins, anyone that has experienced violence. Gun violence, domestic violence, any violence matters to us here at Hug a Child non-for-profit.
Awesome, amazing. Now, Saleshea is the first member to be featured on this podcast who is a part of the city's Gun Violence Survivors Leadership Network. The Gun Violence Survivors Leadership Network is an advisory group of community leaders who are also survivors of violence, survivors of gun violence, who have lost loved ones to gun violence in Chicago and are working tirelessly every day to support other survivors who are impacted by violence. Now, Saleshea, just if you could share just a little bit about your experience with the Gun Violence Survivors Leadership Network, and particularly its impacts on the community at large.
So the Gun Violence Survivors Community Network has been a pillar to me and a lot of leaders in our community. We sit on the board with mothers that demand action. We sit on the board with fathers that demand action who has lost children, and just having that resource and being able to partner and bring our resources together to help the community in the city of Chicago is immaculate, because everyone has different entities that can help one another. So that's powerful to what we're doing. Being able to partner, being able to have those resources, being able to have one another for support in the work that we do.
Absolutely, and definitely appreciate all of the support, the leadership, the guidance, helping to drive policy, and just everything that is really helping to carve out how the city can best be a support for gun violence survivors citywide. Now, with your work, you also do a lot of amazing work working individually with families, individuals who are impacted by violence, and we have worked together at the CSCC. I believe we met, it'll be 3 years, I think, if my memory serves me correctly. It'll be about 4 years in June. We met at a gun violence event in Garfield Park, and we've been rocking and rolling ever since. So I just, in terms of your individual work with survivors, can you just share a little bit more about that and how people have been impacted through the efforts of your organization?
So helping survivors, being that support net that they need after the funeral, after the services, making sure that you're connecting them to the correct resources, making sure that you have the outlook of you guys at the mayor's office who does the work with victim services is completely what I do. Just making sure that I have those partnerships and tuning in to those mothers and fathers who have lost their children. They need that support. They need check-ins. After the funeral, everyone is gone. So my organization stays until the parents or the family say, hey, we're okay. Now we want to be a part of that. We want to be a youth mentor. We want to go with you to peace marches. We want to help you provide services to other families. I want to be a mom that demands action. So that's what I've seen, the transition with mothers and fathers, that they want to help other parents out here after their healing journey, after their walk. So that's why I think it's so needed to have victim services, because there's no way for these parents to make it in their dark times without the support of these small organizations and larger organizations, if they are doing the work that we do and stand by their side.
Awesome. Yeah, absolutely. And you hit on so many critical and important things. One, it does take a village. Also, you did share, you actually answer a little bit of my next question. And thank you so much for just all the work that you do and what you shared. But I wanted to go a little bit more into your why. And you shared a little bit about it, but just if you can go a little bit more into, kind of how you got started with this work and why you do what you do.
Well, I was raised to do this work. My mother was a pastor's wife, and after funerals, my mother would make food, cakes for weeks, months, and years to come, to be that support net to other families. So I saw that growing up. I saw that my mother was there to support families in that losing loved ones, not to gun violence when I was growing up, but just losing loved ones, to always be that safety net and that support to their children, having our house open up to fun-filled days, making our house a community of youth there engaging in Jesse White tumblers. My brother was a Jesse White tumbler, so he taught the children in our area how to flip. My mom taught children and adults how to cook. Just being the support network, a shoulder to lean on. So that's where I got the compassion for them. It was embedded in me, but also losing a youth in my community on the near north side, and I knew that family, grew up with that family, and saying like, look, it's something that I have to do, and that's been 6 years ago. And ever since then, I wanted to be that support net. I wanted to do community engagement. I wanted to do violence prevention. I wanted to bring awareness to our city. And I got a team of volunteers and people that supported me, and we're out here doing the work.
Awesome. Amazing. Thank you so much. And you also hit on, as I mentioned before, it takes a village. So there have been a few times in this conversation already that you talked about just how critical and important it is to collaborate with others. And so I just wanted to just do a deeper dive into your experiences collaborating and the importance of, in this space, of supporting survivors of violence, just more broadly. Why collaboration is so important, whether it be from other community stakeholders and community partners who are doing the work, or just other folks that can just step alongside and help survivors on their journey to healing.
I think it's both. Community partners and other stakeholders and political parties, we all need to stand together because we're all human. We all lose loved ones. We're all experiencing the same thing of losing our loved ones to violence in the city of Chicago. Just because we're out here doing the work doesn't mean we're exempt. I lost my brother June of 2024. I've lost family members that are really close to me to gun violence, and that's why I continue to fight. I continue to be the person that I want to see other people be, but partnering is a factual statement. We are so much better together. You can't do this alone. Having a support network and having a pillar of people that are here with you, lifting you up, the more it's really the merrier.
Absolutely. And unfortunately, because of just the number of people who are impacted by violence in this city every single day. And like you said, when the balloon release is over, when the funeral is over, the cards and the calls kind of slow down or stop, those families are still hurting. Those families are still healing, and the work still continues. And unfortunately, it's so pervasive in the city that it really does take a village of all types of partners and community really working together. And so just really appreciate that perspective. Always really good to talk about collaboration and coordination, because support to survivors of violence is the support is missing. It is not a trauma-informed process unless there is coordination and collaboration. So again, thank you for your work in that space.
Thank you. But The bigger companies, that's why I tell the smaller organizations to go talk to those bigger companies because they have a plethora of more resources than us. And they're able to provide those mental health services. They're able to provide those coaching sessions, those grievance counseling, those conflict resolution, conflict divisions with the violence that's going on. So I partner with any organization that I can, any political figures that know that I'm doing the work and political figures that don't know that I'm doing the work. And I'm partnering with the youth because they are the ones who know what the hurdles and barriers are that they're facing and why these guns are getting in their hands and why domestic violence is starting at 14 and 13 years old, to provide them that space and meet them where they're at. That's what we do.
Absolutely. And you said something really important. You having a grassroots organization that you started with just you and have built from there. What advice would you give to other small grassroots organizations, whether they're doing the work with supporting survivors of violence or just in general, but we can focus on the support in this space. What advice would you give them in terms of what is needed in order to collaborate with some of the larger partners in order to get those resources?
Walking in these organizations, letting them know that you're genuine and authentic about this work, telling them who you are, trying to make partnerships and Mirandas of understanding to let them know, like, hey, I'm out here, I'm feeding the homeless, I'm stopping the violence, I'm providing mental health resources, I do grievance, I do therapy. Just going in those organizations, meeting with those elected officials, meeting with stakeholders, meeting with communities, meeting with the youth. That's my recommendation. All the time, especially meeting with the youth because they know what trauma they're facing. We are in a different age bracket and different era of time. So getting them to open up and build rapport with you, making sure your paperwork is in line, and finding someone to help you get funding. I have been doing this for 6.5 years. I have never received a grant, any state funding, any sponsorships, or anything. This has all been from me out of pocket and finding ways that I can try to fundraise as much as possible and get donations, but the funding is the problem. Partnering with somebody that knows how to write grants, getting somebody that will help you and assist you, because that's the only hurdle I make. Doing all of this out of pocket, burying families out of pocket, helping them with repasts out of pocket, helping them with funeral services. That's a lot. It really is. But when your heart is genuine and authentic, the money means nothing. You really want to help the survivors.
Absolutely. That is really important. That's something that we've even talked about in the many conversations with the gun violence survivors leaders, because many of them come from this lived experience of losing a loved one to violence and have started their own organization helping survivors do the same thing, and really need to there's a need to just kind of come together to have the resources and to brainstorm on how to get those resources and support. But there is there's definitely a need that that I know we have talked about around support for smaller grassroots organizations. That's something I have a particular interest in because I see you all out here doing the work every day. So let's just continue to have these conversations. Definitely continue the advocacy, and I think you are an example of what great communication looks like with other larger organizations and folks that do have the resources. So just want to continue to support in that space. And just pivoting just slightly, to just talk about in your work with survivors of violence, what would you say are some, let's do a little bit of a deeper dive in what you're seeing on the ground in terms of need, any particular themes as far as needs that you see more broadly for survivors where there just needs to be a little bit more support and resources and things that we may need to highlight there.
So what I see is when crimes happen and parents are trying to start their healing journey and the crime happened at their home, getting them transferred and getting them housing support has been the hardest thing that I've ever experienced. I don't understand how the city or anyone would want a mother to continue to hurt where the hurt happened. It's hard to find a place for those mothers to go. And it's traumatizing to continue to live and walk out the same door where senseless violence took your 7-year-old baby. How do I heal where the hurt happened? So that's my most concern. I know housing is critical in the city of Chicago, but I feel if an incident happened where you live, we have to find resources, more resources to transfer those parents out of the hurt. They cannot heal where the hurt happened.
Thank you for sharing that. And I know we and some others on our team, we've worked very closely together with some particular, situations like that. Was really trying to help find support with housing. Housing has been, in my own experience in my work, being with the city now made 5 years, not too long ago.
Congratulations.
Thank you. Housing is definitely one of the bigger challenges that the survivors of violence more broadly experience. And so we know that this is a systemic, issue, and we are really bringing light, shedding additional light. So the more that we can amplify these stories, the more that, folks can go to the drawing board and let's try to figure out solutions. So I thank you for just your work in that space, but also definitely welcome opportunities to talk about it a little bit more. So thank you for bringing that up. And just want to pivot to, I know we talked about some of the challenges, some of the themes in terms of needs and supports, but there's also a world where things have worked well and things have, in terms of your role and all the support that you provide. What would you say in terms of just victim services, support to survivors of violence? What has worked well in the ecosystem that you, in your experience as you're working with different partners?
Continuing to engage, continuing to be authentic, continuing to be the person on the other side showing empathy, putting yourself in someone else's shoes critically has worked for me because I have children and my fear is the same as those mothers and fathers of losing any three of mine. So I know what I would want if it was me. So what has worked is me being who I am, me showing that empathy, and more people like me. I'm not the only one out here, but we need more of us. And we were just in a meeting about that. It's a lot of us, but we need more. We need recruitment to people that are really ready to engage in this work. And of course, we need funding, but just more of us. Putting yourself in someone else's shoes who experiences that, your heart would never not waver for them if you are who you are.
Absolutely, definitely. And just you hit on a few always hitting on some key things in your responses, but just really wanted to just kind of focus on the people who are healing, right? What encouraging word would you give to that mom, to that brother, to that grandmother, grandfather, that cousin that is hurting, that is wanting to connect for support, but just may not know how, may not know what to do. For those that are tuning in and can resonate with that story, what encouraging word would you have for them?
I love you. Those would be my 3 encouraging words. I love you. Because I know it could be me. You have to empower. You have to show integrity. You have to show love. There's no way in this world we can make it without love. And I love you. And I can do the best that I can by you. And I'm going to fight with you, for you. I love you. That's all I can say.
That's very powerful. And love can do so much. And that is really a really key component when it comes to folks who are out here who feel like they don't have that support, who they don't have that love to kind of get through their healing journey after losing a loved one. And just to know that there are people out here that are just willing and ready for you to just come into their orbit and just come alongside you in your journey of healing. So just wanted to provide that word of encouragement to any survivor who is tuning in, that there are people out here who want to help, who want to support, and who love you. So thank you for everything and for all the work that you do. I think this is a great note to close out the conversation. Again, just thank you for just everything you do. Appreciate you taking the time to really, share the work and share your love for people, for community, for survivors. If you can, before we close out, if you can just share a little bit about kind of some things you have going on, what is next for you on your journey, and anything that you want to share about the work of your organization.
So it's my pleasure to be here, Stephanie, and thank you for all the work that you do, the support that you give all of us in the Gun Violence Leadership Network. My work is in poverty areas of the city of Chicago. We will have building blocks back together starting May into September. Those are the crucial, critical, violent months, are the summer months. So we are bringing fun-filled days, gun violence safety through Lurie's Children's Hospital, giving you gun safety logs, giving you a 20-minute briefing on the gun safety of having guns in your house, bounce houses, barbecues, resources, community leaders, politicians. We want them all there from May into September to engage. I will be in the North Lawndale community, East Garfield, Austin, Inglewood, Chatham, Auburn, Gresham, Bronzeville. So in these next critical months, you will see us in your area. And that is my goal, to go and build up in these poverty areas, to bring community resources, community centers, skating rinks, bowling alleys, boys and girls clubs, things that we had growing up that kept us off the street, and bringing them to those communities like North Lawndale, and bringing them to those communities like Inglewood. Inglewood has a beautiful skating rink. We need to do that in North Lawndale. We need to do that in East Garfield. Bowling alleys, something to keep the kids engaged. Cleaning up the parks, putting more in the parks that we have. We're going to be at your local park. We will be there May into September, building blocks back together for community peace. Watch for us.
Amazing. And we are there right alongside you, supporting you in your journey. Thank you again for everything that you do for community. Thank you for everything that you do for survivors that are on their path to healing. And so, looking forward to continuing to co-create in this space with you. But for now, we will close out, and just want to thank you all for tuning in. This has been another episode of the Healthy Chicago podcast, and we'll see you next time. Thanks.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.